Hype and fear surround artificial intelligence taking jobs in healthcare. Will it render physicians obsolete? Will it replace the majority of medical professionals? The Medical Futurist decided to set things straight. Here are 5 fundamental reasons why artificial intelligence won't replace doctors and never will. 1. We cannot replace empathy. Even if the array of technologies will offer brilliant solutions, it would be difficult for them to mimic empathy. Why? Because at the core of empathy, there is the process of building trust, listening to the other person, paying attention to their needs, expressing the feeling of compassion and responding in a manner that the other person knows they were understood. At present, you would not trust a robot or a smart algorithm with a life-altering decision or even with the decision whether or not to take painkillers. For that matter, take the example of the NHS and their experiment to ease the burden on their health lines with chatbots. Patients participating in the trial indicated that they would play the system to get an appointment with the doctor more quickly instead of taking the recommendations of a chatbot. That might change in the future in case of simpler health questions and patients taking more responsibilities in their care. But we might never be able to imagine healthcare without human empathy. We will need doctors holding our hands while telling us about a life-changing diagnosis, their guide through therapy, and their overall support. An algorithm cannot replace that, ever. 2. Physicians have a non-linear working method. There was an episode in House MD where the team couldn't figure out how a young boy could have been poisoned. They considered many options: drugs, food poisoning, pesticide poisoning. For every possible diagnosis, they suggested a different treatment option. Each one of them made the patient worse, until they figured out, by accident, that the boy picked up phosmid, a type of insecticide, from the jeans that he bought from a street vendor who kept the trousers in a truck. The boy didn't wash the piece of clothing before wearing it. That's how his skin could absorb the poison. No algorithm could have made that diagnosis. Although data, measurements, and quantitative analytics are a crucial part of a doctor's work, and it is going to be even more critical in the future, Data is the new oil or bacon. Setting up a diagnosis and treating a patient are not linear processes. It requires creativity and problem-solving skills that algorithms and robots will never have. Patients and their lifestyles vary to the degree that people differ. Diseases have the same feature. Thus, no case is the same. Every one of them requires the attention of human physicians. Until the emergence of complex, digital solutions, doctors translated data coming from simple medical devices into medical decisions. In the future, the task will be the same. They will only use more complicated technologies. 3. Complex digital technologies require competent professionals. More and more sophisticated digital health solutions will require the competence of qualified medical professionals. No matter whether it's about robotics or artificial intelligence, take the example of the most commonly known surgical robot, the Da Vinci surgical system. It features a magnified 3D high-definition vision system and tiny wristed instruments that bend and rotate far greater than the human hand. However, surgeons have to learn how to operate it, and it takes practice to master it. Likewise, look at IBM Watson. Its unique program for oncologists. We interviewed one of the professors working with it. Provides clinicians evidence-based treatment options. Nonetheless, it's only doctors together with their patients who can choose the treatment, and only physicians can evaluate whether the smart algorithm came up with potentially useful suggestions. No robot or algorithm could clearly interpret complex, multi-layered challenges involving the psyche. While they will provide the data, interpretation will always remain a human territory. 4. There will always be tasks algorithms and robots can never complete. Physicians, nurses, and other members of the medical staff have plenty of cumbersome, monotonous, and repetitive tasks to complete every single day. A study says that in the United States, the average doctor spends 8.7 hours per week on administration. Psychiatrists spent the highest proportion of their working hours on paperwork, followed by internists and family general practitioners. These types of tasks and procedures can be automated, and they should be. However, there are responsibilities and duties which technologies cannot perform. While IBM Watson can sift through millions of pages of documents in seconds, It will never be able to do the Heimlich maneuver. There will always be tasks where humans will be faster, more reliable, or cheaper than technology. 5. It has never been tech versus human. The consistent and constant enemy image building should stop once and for all. It has never been technology versus humans, a sort of them versus us, since technological innovations always serve the purpose to help people. We are playing on the same team, no matter whether it's artificial intelligence, robotics, augmented or virtual reality. We should accept that they have a massive influence on the way healthcare operates, and then start utilizing their power. Imagine what healthcare could be capable of if the creativity and problem-solving skills were combined with the infinite computing power and cognitive resource of technology. Collaboration between humans and technology is the ultimate response. A study for identifying metastatic breast cancer through deep learning shows something similar. When the deep learning system's predictions were combined with the human pathologist's diagnoses, the image classification, as well as the tumor localization score, increased significantly. Moreover, the human error rate decreased by 85%. The findings show that artificial intelligence and humans are the most potent when they cooperate. Thanks for watching. Click on the subscribe button now for more videos like this, and turn on the notification so you don't miss out on anything.